Hey, it's Ambria. This is my newborn head-to-toe assessment video. Before I go into the room, I make sure to have my stethoscope. I'm going to bring a bulb syringe, and I have my pen light. I'm going to introduce myself to Mom, let her know my name is Ambria. I'm the nursing student that is going to be taking care of her baby today, and I'm here right now to perform a head-to-toe assessment on her newborn. I'm going to go wash my hands, perform hand hygiene, and I'm going to put some gloves on. Coming over to the bassinet, I want to make sure there is nothing in there, no pillows, no blankets, no little stuffed animals or anything like that. And I have my bulb syringe in case I need it. All right. I'm going to use the pads of my fingers to palpate for the suture lines and for the fontanelles. So the coronal suture line and the sagittal suture line are not fused, they're open. The anterior fontanelle is soft, flat, and diamond shaped. The posterior fontanelle is triangular, soft, and flat. The head is symmetric. There's no edema, no swelling. There's mild molding, but that's normal after a vaginal delivery. It's temporary and it will go away. All right, and now I'm gonna grab my pen light. I'm checking for pupil responses and for the red reflex. Sorry. Okay. The eyes are symmetric. Her pupils are equal, round, and reactive to light. The red reflex is present. Her pupils are 2 millimeters bilaterally. The ears are in line with the outer canthus of the eye on both sides. For nasal patency, I'm going to occlude one nostril at a time. There is no nasal flaring, and the nostrils are patent bilaterally. Okay, now I'm going to inspect the mouth. I'm gonna insert my finger. I'm feeling for the top palate. It's closed. Her tongue is midline. Her mucous membranes are pink and moist. Also, I'm going to test her sucking reflex, and the sucking reflex is present. I'm also going to test her rooting reflex. She's going to turn her head towards that stimuli, and that reflex is present. Okay, I'm going to start uncovering the baby. Her skin is pink, warm, and dry. The turgor is good. There's no jaundice or central cyanosis or anything like that. There's also no rashes, lesions, or birthmarks in this area. Okay. Also, she has 5 digits on each hand. Her capillary refill is brisk in less than 3 seconds, and she has full range of motion for both upper extremities. I'm observing the rise and fall of her chest. I'm counting her respirations for a full minute. Her respiratory rate is 40. They're even, unlabored, no retractions. I'm going to take the bell of my stethoscope and I'm going to listen. Okay, breath sounds are clear bilaterally. She has both nipples and they are symmetric. Okay. Also, her radial pulses are 2+ bilaterally. Okay, I'm auscultating for the aortic, pulmonic, tricuspid, and mitral areas. I'm going to count the apical pulse for a full minute. Her apical heart rate is 130. The rhythm is regular. There's no murmurs and no extra sounds noted. Okay. Moving down to the abdomen, bowel sounds are active in all 4 quadrants. No masses or nodules. The umbilical cord site is dry, and there's no leakage or anything coming from it. Okay. We're going to go ahead and remove the diaper. The anus is patent. It looks like meconium has been passed. The labia majora is covering the clitoris. There is a little bit of red tinged discharge, but that's normal. That's where the mother's hormones are passing through the baby, and it's giving like a pseudo period. Okay. I'm testing her palmar grasp, and she is grasping my fingers when I place it in her palm, so that reflex is present. Let's see. Now I'm gonna do the Babinski reflex on her. Her toes did not fan out. She retracted her toes, so that would be a negative Babinski reflex response. Okay, now I'm listening for hip clicks. There are no hip clicks present. There are 5 toes on the left foot and 5 toes on the right foot. The capillary refill is brisk in less than 3 seconds. All of the extremities are symmetric in length and movement, full range of motion in both upper and lower extremities, and the muscle tone is good for both upper extremities and both lower extremities. And also, we have to check the spine in the back. The spine is straight and intact, and there are no dimples and no tufts. Oh, okay. I'm gonna put the hat back on the baby. And that is the end of my assessment. Thank you.